All right, thanks guys for joining us. Thanks for being here this morning. We are going to be having these outside to maintain proper social distancing, and just want to stay consistent with these weekly press conferences, especially considering the current crisis that we're in with the coronavirus. Today, the county has announced there are 64 total cases in Sedgwick County and 1 death so far. There are 482 cases in Kansas. We expect to see that rise as far as confirmed cases because we are getting more testing. So we've already known that this is in our community. We are having what's called community spread, which means people are getting it by not following the stay-home order and going out and visiting with people, and not just from traveling. So we expect that number to increase, but I think that our staying-home measures have been slowing the spread of that, and this is really the crucial time to be sharing with friends how important it is to be using stay-at-home precautions and using social distancing. Just an update on the personal protective equipment. The distribution from our community warehouse has resumed on Monday. We continue to receive new resource requests from community partners and are passing them along to the state. In the meantime, we are working to streamline the request process within Sedgwick County to make these orders easier. So we've also announced that we're continuing to use city resources and innovative ways to try to help our partners over at Sedgwick County deal with this current crisis. We've offered them Century 2, and they're using it as a decontamination area for emergency vehicles. I believe some of you reported on this last week. What it is the emergency vehicles are actually able to drive in, and we're using our machines that are detoxing, or not detoxing, they're a mist that they're using to sterilize the machines and the equipment that first responders are using. Some employees at the airport have been reassigned to sew masks for medical personnel and for emergency responders. Teddy Wisely, one of our dedicated Wichita police officers, has begun a movement for 3D printing of masks in for emergency responders. One of the things that Wichita does well is manufacturing. And part of that is having access to 3D printers in our educational institutions. I think earlier this week we saw that Wichita State is utilizing some of their resources to create masks that we need to keep our people safe and take advantage of our own community assets at the same time. The Continuum of Care is working with emergency of operations with the county to ensure our population who is homeless is taken care of. Humankind and Unity Rescue Mission is making sure their clients are maintaining physical distancing, using temperatures, taking temperatures, and isolating those who display any symptoms. The City Public Housing Department is looking at our funding resources and potentially relocating funding to help the homeless population. This is something we're taking serious. We're a partner at the table with this, so we are working with the nonprofit sector and also our friends over at the county government to make sure that we're not leaving any populations behind. We are evaluating a couple of public facilities to see if they are safe and appropriate to house homeless populations. If there is an outbreak in our residents who are homeless, but again, we're still evaluating those facilities. Some of you have heard me talk about how we are offering the former library as a possibility for this. That's still being discussed. So for furloughs, as many of you have heard, we had, this county manager had to make the tough decision to furlough roughly 300 city employees. But thanks to the generosity of our city workers who have come together to pool their sick and their vacation time, we have made it so that at least 30 days will be paid to employees who are furloughed at this time. So just a reminder, maintain physical distancing, wash your hands, and continue to practice good hygiene. Stay at home when at all possible. This is the key to us flattening the curve. Remember, the goal is to make it so if people get sick, they have a bed to go to at the hospital. Right now, we are doing better than other communities because people are taking this seriously. They are staying at home. They are utilizing social distancing. And I know not everyone is. I get a lot of feedback about, did you know this is going on over here? Or did you know that that is going on? And I'm in constant communication with our chief of police, who is getting his officers out there to educate these people on the dangers they are putting their community in. And we are shutting down operations who aren't taking this seriously. So with that in mind, we got to keep doing what we were doing. According to the modeling, this might peak in the next 30 days. Now is the time to not give up on social distancing. Now is not the time to take our foot off the gas. If we do this right, we can get through this while having the smallest impact on our vulnerable population. That is the goal. Let's get through this and get back to normalcy without having people in our vulnerable population wind up as casualties. Also, on a lighter note, please don't forget to fill out the census. The census right now, as we're at home, you can do this online. It's very important that we get the census done because the amount of people who fill out the census will actually add to the amount of money that we can get from the federal government for the next 10 years. We can only do the census once every 10 years, so we got one shot to do this right. Please fill out the form that was mailed to you. It takes about 5 minutes. If not, look up Google online the census at an official government website, and you can fill it out there. And I'll open up to questions. So as I've said before, we're partners with the county. They're the ones who are in the driver's seat when it comes to utilizing these type of resources. They are the Department of Health, and they have that type of information. So I only know really what you guys know. I'm brief, just like you guys are. And as far as testing, all I know is we are likely to get more. And I have been informed that we might be able to get some faster tests that take 15 minutes. And it's very important with this. And like I said, two things with the testing. One is we are going to see a rise in confirmed cases because we're going to have tests. That I don't think is a cause for panic, right? Because we already know it's in our community. If we do the testing right, then hopefully we can isolate people who are showing symptoms so that they can be treated instead of passing on those symptoms, and possibly we can find out if there's any trends. Is there any particular areas that are getting hit with this harder, and could we increase testing in those areas? So there's a lot that we could do with the testing, but again, like I've said for weeks now, the cities internationally that are the model for how to handle this aren't the ones with the most tests. They're the ones who take social distancing seriously. They're the ones who stay home, unless they have to go out, and if they do, they come back in. Those are the cities that have been doing this the best. They take it seriously, and they're taking it upon themselves to practice, the best practices. Other questions?
You talked about repurposing, redirecting some employees to make masks.
Yep.
Tell us a little bit more about that, how that's going to
So I need to be brief further on this to give you much more details than that. However, there has been conversation, particularly with our furloughed employees who are getting paid at least for the next 30 days, of seeing if they could be willing to volunteer at the United Way, see how we can have an all hands on deck approach to solving this situation. And I think a lot of them want to do that. Also, it's not just our employees, but if you look on Facebook, there are people who are furloughed, they're laid off, they're at home making masks. They are signing up on ICTresource.com to see if they could be runners to go to the store and get food for the elderly population who shouldn't be out right now. So we're seeing really the best of our community come out of this crisis, and that's people who want to be a part of the solution. And part of that, my role, by getting United Way at the table and having them be kind of our one-stop shop for the nonprofit industry, is not just to take from them, but also to give them the people who want to volunteer as a resource. Other questions? Yes, of course. That last question was about furloughed employees and other employees, if they're to continue on the comment I said about masks. But good point, thank you.
You said you've been working with
So we're seeing some, in my opinion, in the way our system's kind of set up, is this, there is no blueprint. All right, this thing hit us and we responded the best we could, or the county did, with their stay-home order, which is now the state stay-home order, which has a list of exceptions so that we can find that balance between keeping people safe and continuing, the needed business of our society. However, I believe we have some people who are finding loopholes in it. And really, that's kind of how our system works, where a decree comes down from a government agency and people find loopholes in it, and then they go and they fix it, and the reality is that that's a lot of what's being reported. And then you got the people who are just outright, we refuse to believe this is a problem, we deny the science of medical modeling, and we want to continue life as normal. And those people are putting people at risk. I mean, that's the problem. It's not just about you. It's if you catch this, you can go give this to my grandma. And so it's not about you, it's about our community, it's about our neighbors. Those have been the type of issues. However, in my communication with the chief, through education, they have been able to stop this. We haven't gotten to a point, at least at this time that I know of, where we've had to take other measures. We do have some tools in the toolbox at the city level where we could take other measures if we have to people who are just in outright defiance. But the other stuff when it comes to businesses who are exploiting the loopholes, we got to look at this not as, in my opinion, not as what the language of the law says, but what is the spirit of the law. The spirit of the law is to stay safe, to keep people safe and to stop the spread of this thing so that our vulnerable population won't feel the worst of it. And that, I think, is a spirit, and if we can be looking at it through that lens, then as a community, we're gonna do better with this. So I should have repeated the question, shouldn't I? Sorry about that, Megan. The other questions?
I apologize if I missed this, but how many employees have been diverted to making masks?
I don't have an exact number for you at this time. It's something I actually learned today, but in the spirit of transparency, I want to make sure I get that information out to you guys. I hope to be briefed by the city manager today and be more up to date, and of course I will be able to post that information as soon as it comes to me. His question was how many city employees have been diverted to making masks or joining in the effort, and I hope to follow up with that, but it is new information I just received, and I wanted to make sure it got out there as quick as possible.
And do you know where they're doing it? Are they doing it at home? Are they doing it in a place
My understanding is that they'd be doing it at home, but I will double check to make sure of the accuracy of that. Right now, we are on a skeleton crew at City Hall. Services should continue, but also we want to make sure that the people who can work from home are working from home, and same thing with people who don't necessarily have to be here at this time, because we have a scaled back services that we're providing. They're at home as well. Questions or comments? You guys have been great. Thank you all. Reach out to me anytime if there's anything I can do to be more transparent, to give you the information that I have. I'm happy to do that. You guys, I think, are saving lives by getting this information out. This is a tough road ahead, but we're going to get through this together. I really can't thank you guys enough in the media who are sticking to the facts, getting the proper information out there so our citizens can make the right decisions with that information. Thank you all.